You want to
All right, there we go. Make it official. So thank you for all attending.
You know, I just need to get this started. I often listen to.
Okay. Yeah, if you can mute your line, that'd be great. We're going to get started here to present our community coordination initiative through the National Aging and Disability Transportation Center. I am Jeremy Johnson Miller with NADTC. I've been the lead on this project for our community coordination initiative this past year. Today, you're also going to hear from Danielle Nelson with FTA, and she is the CCAM strategic plan lead with FTA. And also from Mike Spatafor with one of our coalition teams in Kansas, and he'll talk all about his project there and the great work that they've done. First, we'll start with our coordination initiative. It started about a year ago around this time. And for a while, we had been working with a National Coordination Advisory Council, and those members will be on the next page here, but they helped guide us through conversation and ways to better coordinate with our communities around the country and how we can best support as a TA center and how we can better improve our products. And so through those conversations with the council, first we did some work on a coordination committee toolkit. And then we worked in some case studies, and then finally the coalition teams that we'll hear about today. Our coalition members are listed here. As you can see, they're kind of a wide range of backgrounds or different organizations that represent aging, different mobility management type focuses, Council of the Blind, Independent Living Centers, Department of Transportation's, Department of Health, and area agencies on aging. And I do want to announce too that Mike Spatafor is now a new member of our council. So that's good to see that, and he'll continue on with our work. The first product that the council worked on with us was to create this committee toolkit. And so within that, they helped us both write and pull together different examples, including lots of different linkages and different examples from all different kinds of backgrounds and different approaches. So that was really intuitive for us to build this type of toolkit with their knowledge from the field and their expertise from different angles and different groups to bring together. And so real quickly, the toolkit is separated into different categories. And so we really start from the ground level and, what sort of information is out there through needs assessments, different types of environmental scans. Have there been some regional surveys or, on the ground surveys like bus surveys that have been conducted by transit agencies, and, really taking scope of where your stakeholders are, different community assets, and really what exists in your community that can really get you started with this coalition committee to really build that coordination effort. Then it moves into growing your table and how to recruit different members, how to attract those different members, or talk to different community organizations that might want to get involved. It does talk about crafting different communications and messaging to frame your coalition and how to, again, attract those new members. And then lastly, it talks about the organization of your committee and establishing vision and mission statements, developing goals, objectives, and action plans. Different performance measures that your committee can focus on that really sets a structure for the coalition. And then different aspects of outreach and public engagement, as well as how to facilitate effective meetings. And then lastly, sustaining your committee. And we can get a link to to this chat so that way everyone can see it. So I wanted to share that real quick. I also mentioned that we did some case studies. So again, some of our national coalition meeting or our committee helped us with some local case studies. And so we did 4 case studies, one in Georgia that was focusing on how they coordinated with different partners. So they were integrating 5 transit programs into one program. And so that case study, all of these can be found on our website. So that particular one was focused on integrating programs. One out of Virginia was focusing on the unique geographic challenges that are in their very rural areas of Virginia. We did one in Colorado that was focused on getting transit resources into a centralized website. That way it could all be in one place and people could access that easily. And lastly, one in Arizona, they were looking at implementing technology for rides in their rural areas of Arizona outside of the urbanized area. Again, we can, the link is here, but everything with our coordination initiative can be found at nadtc.org/coordination. And so you can see all of our coordination committee members as well as the publications that I was just talking about. So now what we're here today to talk about is our coalition teams. And so like I mentioned, last year we started out about this time. And we really wanted to work with 2 communities that we could really focus on, either communities that had established groups or communities that were needing just a little bit an extra push. And so this statement was in the RFP that we put out, and is an initiative that aims to strengthen partnerships in the community, begin or reinvigorate discussions about
Hi,
transportation,
Lobster. I see you have
convene a
gotten
coalition to address transportation barriers, and generate or sustain positive change. And so we ended up getting several applications, but 8 were eligible. And so we put it out there to anybody who received 5310 funds. And so we got quite a bit of applications, but we focused on 8 and reviewed those, and then we chose 2. One we'll hear about today out of Topeka, Kansas, and the surrounding county areas there, and Connectability out of St. Cloud, Minnesota. Connectability will be presenting at this time next week, and so you can hear from them at that time. Through the coordination committee, or the groups that we worked with them for 2 days in person, each team, and we led a facilitated conversation, and we first wanted to establish a sense of urgency. So what are all the issues and gaps that are needed or are seen in the community or surrounding area? And what we did was we brought together a group of transportation providers, human services agencies, different community providers, healthcare, AAAs, all of those partners coming together to talk about transportation. And so together as a group, we did not guide them in any sort of direction. We let the conversation go to where they wanted to go. And so as a group, they created a vision. And from that vision, they developed an action plan that was written right on the spot while we were there with them. And so by the end of that 2 days, they had an action plan in place that they could work toward. And within that action plan, you have objectives that are pretty specific to what they are looking for. And within each of those objectives are what we're calling SMART goals, or steps toward that objective. And so those are specific, measurable, achievable, relevant, and timely. So you know exactly what you're working toward and how you know that you'll be successful and on a time frame. And so once that plan is developed, We met with them monthly to establish ways to grow the coalition, how to expand those thoughts and ideas within that plan, but also structuring it for sustainability. Are there any subgroups that need to be made up of the group that can work offside from the larger group, or how can this be pushed into the future and work together to make it work? We will be hearing from one of our groups, but I wanted to talk about our other group that we'll hear about next week. But Connectability, they had a really large network of volunteer transportation providers. And so Connectability was the main applicant, but they attracted quite a bit of these volunteer providers, and they were looking at ways to coordinate better between all of them. And so they all sort of operated in their own silo, and they wanted to coordinate together better, either through sharing resources, or if one was not looking for any volunteers, they could refer to the other one where they could share their volunteer driver sources there. They were also looking at developing a centralized website for information and resources. And ultimately, their end goal was also to develop some strategies for recruitment and retention of those drivers. So again, you'll hear from them next week. So join us for that one, and you'll hear from their project specifically and all the objectives that they looked for. So I will stop talking for now, and we'll move on to Danielle Nelson from FTA.
Thanks, Jeremy. Hi, everybody, Danielle Nelson, and I just wanted to acknowledge several of my colleagues who are also on today. So Sarah and Michael and Lynn, thank you for being here. And also we have Taylor B. from the National Highway Traffic Safety Administration also. So welcome, Taylor. So I am the staff level lead for something called the Coordinated Council on Access and Mobility. If you go to the next slide, it's an 11 federal agencies that you see there under organization led by USDOT. Our secretary has delegated the authority to lead this council to the Federal Transit Administration because we have the most programs that are in the CCAN program inventory. And so it was started by executive order way back in 2004. Congress put it in our authorizing legislation. So now we are mandated by Congress to maintain a strategic plan. And we regularly are approached by the committee that oversees it to make sure we maintain a strategic plan or actually implementing it, which I'm going to briefly share with you what we're working on right now. And then the purpose of this coordinated council is to improve human services transportation, specifically for the three populations you see on the slide here. So older adults, people with disabilities, and individuals and families of low income. And if you go to the next slide, so glad you're driving, Jeremy, and not me. These are these sub-agencies. It's helpful. 11 federal departments, huge departments. Which ones within those departments are actually our partners that we're actively working with? So this is from the strategic plan that we just adopted and published. Which one's not on here from USDOT is NHTSA. They are a wonderful partner that we also are working on. Thank you for being here again, Taylor. But we also are working with Federal Highways, our sister agency. The ones you see in blue, which small print, sorry, are the lead sub-agencies under each of the federal departments, meaning they take the leadership role. So for us at USDOT, it's the Federal Transit Administration, and we partner with our sister agencies. It's the same for the others. So like the Health and Human Services Department, we followed the money. So the Centers for Medicare and Medicaid Services is the lead for HHS because they expend the most federal dollars on human services transportation. In CMS's case, it's non-emergency medical transportation under the Medicaid program. And if you go to the next slide, this is really the why. Why does the Coordinated Council exist? Why is it important that we have a strategic plan and are working like you all are in Kansas and others to coordinate? It's about efficiency. When you coordinate human services transportation, you're able to serve more people, provide more rides. It's about accessibility. People can access the transportation, use it, and get where they need to go. And then also just availability. There's more of it if we're more efficient with our dollars. And on the next slide, this is how we developed the current strategic plan that I mentioned is statutorily required. So back in February of 2022, we invited all 11 federal departments and the 29 sub-agencies 29 counts FTA. So there's 28 other partners that we brought together. And we kicked off and we had 10 working sessions with our federal partners. And we decided FTA can't tell you all what to do. What do you guys think is so important? And so what we did is developed those 10 working sessions. We had 38 participants represented at all the meetings, and they represented 21 of the federal agencies. So what that also means, if you look at the glass half full, is not all of them participated, but we had a really good number and we were proud of that. And then what we did is we took our draft, our framework, and we took it to the public. So we did 4 public listening sessions, and we got over 100 different participants, including representatives of national, state, and local organizations, as well as members of the public. And we listened to what they said, and that is how we developed the final plan that was adopted in October 27th. If you go to the next slide, there's a nice little photo of the meeting. It was hybrid, so we had a lot of folks actually come over in person to USDOT, as well as we had a virtual component. So this is a small picture of the in-person folks, but also, again, there were a lot of representatives that have virtually participated. We had the director of CDC provide recorded remarks about the importance of this type of coordination. And so we were very proud of the level of commitment that we received that day. And if you go to the next slide, what I wanted to share with you all is what we've agreed to and what we're currently working on. So we agreed to a set of CCAM core values. And I think the toughest part was defining. Safety means very different things to these different departments, but we all came together and said, these are the core values, and this is what they mean jointly to us. And I won't take the time to read these to you because I know we want to get to the important part of the presentation to hear from our community partners. So if you go to the next slide, these are the goals. We have 3 set goals that we're committed to over the next 4 years. The mission is the Coordinated Council on Access and Mobility collaborates to improve transportation access for all people. And our goal 1 is to strengthen the Coordinated Council on Access and Mobility and improve multi-sector collaboration at all levels and jurisdictions. Goal 2 is to promote the development of safer and more accessible transportation networks. This was a huge one we heard a lot about. In the past, the CCAM hasn't necessarily worked so much on improving access through built environment, sidewalks, trails to get people safely outside of cars, for example, to transit, whether it's public transit, also to school transportation, et cetera. But this is really important to the partners, and so we built this in. And Federal Highways is a partner on this one that's committed to the activities under Goal 2. And then our 3rd and final goal is to address CCAM agency policies that impede transportation coordination. And we heard a lot about what those are, and we've developed performance measures to address the ones we heard in those public listening sessions. And so I'm just going to go to the next slide and share one activity from the plan, because we could be here all day if we go through it. But the one I thought was most relevant to this conversation today is it's under Goal 3. It's about the addressing those policies that impede coordination. And we are specifically developing and publishing a public-facing resource that's going to take, we currently have a federal fund rating guide I linked here and a program inventory. And what we're doing, we heard from the public is that these are great resources, thank you, but it'd be great if they were combined into one searchable database. And also the program inventory has the 130 federal programs that can fund transportation. And we specifically worked with each federal agency to figure out which ones could fund mobility management. So it's a drop down. Is it eligible for mobility management? Yes or no? Can it fund public transit fares? Yes or no? Can you purchase a vehicle through this program? Yes or no? And so we're going to be taking that program inventory and then adding the federal fund rating guide. Which programs can have the eligibility to be used as matched to the 5310 program, 5311? Is it eligible? Yes or no? So we're combining these 2 resources into one. And we finished the federal fund rating guide with only looking at 61 of the 130 programs. So we're committing to finishing. It was a big lift to meet with the general counsel's office of each of the federal agencies. So we only got through 61. So if you go to the next slide. So what is federal fund rating? This is a common question we get. So the term, it means when you use one federal program to meet the matched requirements of another. And so the term braiding means that you're implementing one program, a single project, with 2 braided sources of federal dollars. And so the strands never lose their purpose, and so they're separate, but you're coming together for one program. And it's really important that there's 2 types there's the incoming funding and the outgoing. And so a program considers federal fund rating arrangement to be incoming when another federal program's funds are used to fulfill the match requirement in order to make that single project happen, whether it's a mobility manager or a purchasement of a vehicle or a volunteer driver program. And if you go to the next slide, I wanted to specifically share with you. So what we found is the majority of the 61 programs were silent, meaning their federal statute did not say anything about federal fund rating. If it was eligible, if it wasn't, it was just silent. So the requirement to federal fund rate is that one of the two programs has to have explicit authority. And FTA has 3 programs that explicitly Congress says, yes, you may use other federal funds as match. And those are the 5311 rural program, the 5310 enhanced mobility program, and then the urbanized 5307 program. And I thought it would be helpful. I copied and pasted directly from federal statute what it says that gives that allowability for those programs. And then in the federal fund rating guide, it shows you other programs that are silent, because if they're silent, you can use them. We have the authority on our end. So as long as the other program is silent, you can use it. And only programs that are eligible for transportation are in the resource. So it cuts out the, well, which programs can be used for transportation. That's what we've done on the CCAM level. And then we're working on the federal fund rating guide, and we're adding additional programs so you know which ones you can use. And I also included on this slide the U.S. House of Representatives report, and I quoted the exact language when Congress decided to make the statutory change, in case you wanted to read that. And what they said is coordination among federal agencies that provide transportation services helps to leverage the federal investments for transportation. And on the next slide, I thought it'd be helpful to share a real world example of where this is happening. Kudos to New Hampshire. The DOTs for their rural 5310 funds, they're using CDC COVID dollars as their local match to fund rural mobility managers across their states. And I included a link at the bottom of this slide to a podcast where the state DOT and the state public health speak specifically about this project and how it came to be and how they decided to use this federal fund rating arrangement. And I also linked to the 2 sources of funding if you're curious more about those. And if you go to the next slide here, this is what the program inventory, it's a link to it, and a breakdown of what those 130 programs, where they come from. The majority are from the U.S. Department of Health and Human Services. And I think what's important here is that what federal programs can fund transportation, we answer this question with the inventory. But it's really important to be clear that these programs, the majority, transportation isn't the purpose of the program. It's just an eligible expense, meaning in statute, Congress has allowed the authority for these programs to have funds expended on transportation. And the key is that it's for at least one of those 3 populations. So either people with disabilities, older adults, or individuals, families, or children of low income. And that inventory is a searchable Excel spreadsheet. So you can use the drop-down buttons to find out more about any of the programs in the inventory. And if you go to the next slide, why did we do the inventory? We heard when we did the CCAM listening sessions back in 2018, seems like a long time ago, is that we don't know which programs can fund transportation. And so in response to that input, we developed this inventory. So it's a centralized database that really we hope that grantees will find useful to find detailed information in one central place about programs that can fund specific population transportation. So it has a drop down of who it's supposed to serve, and you can select older adults if you're an aging organization. It also has a drop down for tribes if you're a tribal organization, etc. Now on the next slide, this is about the federal fund rating guide. And so it's a link to that resource, and it's a helpful resource that defines federal fund rating, how you can use it. This illustration here shows the 5311 program, for example, in the vehicle. If you're purchasing a vehicle, you've got the 80% of the vehicle being funded in blue with FTA dollars, and then the green portion is supposed to illustrate the 20% that's being funded by the Administration for Children, Community Living, ACL, not ACF. I deal with a lot of federal agency partners and sometimes fix them up, excuse me. So the Administration for Community Living's Centers for Independent Living funding, and their Old Americans Act Title IIIB supportive services dollars, both can be used as match to these programs. So that's illustrating an example of how the Federal Fund Braiding Guide can be used. And then the little person there is supposed to be a mobility manager, with the head being 20% funded with ACL dollars and the body being 80% funded by FTA. And on the next slide, just the benefits of this guide and why we developed it is that you can find detailed information in one centralized database about how to empower local communities to utilize it to fund projects at 100% if that's necessary. The one thing I did want to caution is that this is a federal fund braiding resource, so you still need to check with your state and see if there's any state requirements or prohibitions, for example. So I just wanted to illustrate that this is specifically only looking at federal laws and guidance of federal fund braiding. And on the next slide, I wanted to just briefly share with you a great new research that came out from the Transportation Cooperative Research Program, TCRP. It was just recently published. It was an honor to serve as an FTA liaison to this panel. And it is a resource for you all about partnerships specific to COVID that started. They did a literature review, they did a survey of FTA grantees, and then they did 4 case studies. And if you go to the next slide, I linked the stuff at the bottom there for you to read more. So the transit agencies were predominantly, there was 113 total that responded to the survey. The majority were rural. And if you go to the next slide, the question they asked was, what type of initiatives did you do during COVID to help partnerships to increase access to essential services in your community? And it was incredible the work that transit did across the country during COVID. And here are some examples: access to vaccination sites. They did mobile vaccination clinics. They provided access to the internet for homeschool and et cetera. And if you go to the next slide, this is a screen capture of the transit agency survey responses about what type of cross-sectoral partnerships they did. So there's a lot of partnerships between FTA grantees with food banks and hospitals and grocery stores and pharmacies. Just a great example of all the types of partnerships that occurred during COVID. And if you go to the next slide, what funding was utilized, which I thought was helpful. A lot of them were using the different COVID dollars that came through. Also state funds, local, there was some nonprofit and non-governmental, as well as other federal funds were utilized. So I thought this was an interesting slide to share. And if you go to the next one, the lessons learned, if there's anything that I wanted to share with you all, the number one lesson learned that the report talks about is that the pre-existing relationships were key. And most of the communities that were able to pivot when COVID hit were those communities that already knew each other and were talking to each other. And that was highlighted throughout the report of that was the most important. And then of course, communication and how COVID really highlighted a greater recognition of transit, public transit's role in the communities and the need for more partnerships. And then 2 last slides are just 2 of the 4 case studies. This one was from Ohio. And really the one thing I just wanted to highlight is that they did a wonderful partnership because of COVID to increase access to food for low-income folks. And the cool thing about this advancing equity food access is that COVID, they've continued it. It's now a permanent project because of the partnerships and the need they addressed. They looked at data from the Census Bureau to identify that the food need, and now it continues because the need was so great and they were able to meet it through this partnership. So I just wanted to mention that it's now a permanent mobile food bank program that the community is doing with transit partnership at the helm of it. And then last slide is a really great example I thought you might be interested in out of Michigan. And they were already doing a trip booking dispatching technology that they were planning to pilot before COVID hit. And the real key here was that it was integral in helping to address transportation needs during COVID. So they had to pilot it and roll it out April 2022. And what they said was it's been this technology has really been key in bringing back riders during the pandemic recovery. And so the pilot was also helpful, they said in the report, about bringing partnerships and helping to coordinate using this technology. So I thought that would be of interest. And with that, Jeremy, I will pass it back over to you.
Thank you, Danielle. We'll put all this information in the chat box. We did have a question about will this information be shared later? Yes. So once both groups have presented, so today and next Thursday, we'll try to be quick with getting that information on our coordination website, and that's nadtc.gov/coordination. And so all that information will be included there. So and once we get that out there, we'll either get it out to everyone or include it in our next either e-news or like an e-alert to go out. So moving right along, we will turn it over to Mike Spatafor and his team in Kansas and hear all about K-CART. So take it away, Mike.
Well, thanks, Jeremy, and thank you everyone who is online right now. We really appreciate having a broader audience than just a couple dozen of us here in Topeka. But we appreciate you coming on, and we hope that you find value in what we're going to talk about today. So we can move on to the next slides. And there we go. So this is a picture of Kansas. Obviously, this is our big picture, if you will, of transportation options. Each colored outline on our map is a different coordinated transit district, or what we call CTD. Each is defined by the regional travel patterns within it. And the CTDs are tasked with coordinating regional transportation options within their own area. So if we go to the next slide, I can zoom you in. So our project is based out of Shawnee and Douglas counties, which are both in CTD1 urban corridor. It is a small portion geographically of the state, but it is a key portion of the population in the state. We tend to run across the state right to left along I-70 as far as population goes, as well as down I-35 to with the Wichita area. That's where the bulk of the state's populations are. And so we decided we're going to start in the middle and try and build our way out of it. The stars on the map, by the way, mark where we have mobility managers located. There are currently 6 of us. We have more coming within the next year or two, so we're very happy to announce that. And just off the map, it's okay. To the right was Kansas City. So there we go. To the right was Kansas City. So you can see how close we are connected geographically, but how far away we are service-based. So next slide, Jeremy. All right. So to give you an example of our regional context, our project area includes both small urban and rural providers. Geographically, as I said, we are close to the Kansas City metro area by car, but not by transit. Many trips that we receive requests for are for medical attention, and that can be anything from medical appointments and checkups to having an MRI done or going to the pharmacy to pick up prescriptions. There's a vast array. Testing, excuse me, COVID now, especially getting access to the sites that are providing COVID tests. And also we have an uptick in the amount of rides that are requested to access dialysis treatment. And so we're focusing on that as well. The counties that you see on the map, you'll notice a giant red line behind them. That doesn't exist on a regular map. I put that there. That's our dividing line. That's the boundary, number one boundary that we have been trying to overcome for years. And the issue that we centered around was that there are great providers in the Lawrence Douglas County and great providers in the Topeka Shawnee County, but because of a variety of restrictions, none of them crossed the county border line. And there are at least 3 major medical centers in Topeka, and Lawrence has some of the best medical facilities in our area. But if you live in Topeka and have an appointment in Lawrence, the things get tricky if you can't drive yourself there. And then finally, I just wanted to note that the smaller agencies in our regions have really stepped up to assist, especially during the COVID pandemic in the early years. It was just amazing how open they were to take trips that they normally wouldn't have taken to make sure that people can reach their medical appointments. So I appreciate that. Next slide, please. Okay. So when we talk about boundaries, we don't just mean the geographical ones. The limitations of various layers of transit, when viewed together, can seem unsolvable. But it was only when we started peeling back each layer that we were able to make progress on potential solutions. So as I said earlier, it wasn't just geography boundaries that we were dealing with. It was, excuse me, service area boundaries. It was funding limitations, programmatic issues, the time-bound nature of some of our systems, like systems that still run on a pulse. They just couldn't make it far out enough before they had to return back to the transit hub. Staffing, either short staff or no staff. We saw a lot of retirements happen early on in COVID, and we totally understand why. And then also the boundary of public support and public image of the services we're providing was another thing that we wanted to address. Next slide, please. All right, so why did we apply? Connectivity to medical transportation for older adults and people with disabilities has long been a focus for additional need in Kansas. Prior attempts had begun to build momentum on the subject through the Mobility Topeka program and the Blurring the Lines coordinated efforts. They included assistance from the National Center for Mobility Management. And then the pandemic forced us all to reimagine our priorities and services based on an unprecedented set of restrictions. So we started building steam and we were getting to a good place, and then the world said no. And so we had to change our focus very rapidly. And we did lose a little bit of the momentum that we had building before the pandemic. Next slide, please. Thank you. So we realized that the technical assistance was the key. Small groups, partnerships, and regional coordination efforts had been attempted over the last 10 or 15 years in our area, but none of them were long lasting. Some of them would have great meetings and then something would happen. An agency might lose its drivers, or a new executive director comes on and has a different plan for their long range efforts. So you know, it is what it is. They did, however, these meetings start to build a framework and establish working relationships between the agencies. And I have to give props to the CTDs that we work with. The fact that KDOT set them up as regional collaborators on transportation solutions really helped us in getting people to the same table. It made distributing information and getting responses back from surveys a lot easier, because they all meet at least quarterly, either in person or on Zoom. So we always had a target audience that we could go to and use them as a sounding board as we developed our action plan. So again, we were working on it and we had some help, but the critical mass level was never really reached due to a number of extenuating factors that we talked about. And then efforts would stall and have to restart from ground zero again. And then after that, I just wrote COVID-19 because everybody knows. We needed guidance from people who understood what we were trying to create, but we didn't have the staff capacity to accomplish it. And that's where our application came in. Next slide, please. So our action plan was developed around using the NADTC's Coordination Committee Toolkit, link at the bottom of the slide. That laid the framework for our plan and made it easier to track which tasks we agreed to accomplish. This list is a subset of that toolkit on the slide that Jeremy showed a little while ago. So it's not the full build out of the toolkit, but these are the items that we pulled for it that we thought were the most important for us to tackle out of the gate. Next slide. And then we started tackling it, and we had everybody share their concerns and identify the current impediments to making the K-CART model work. And you out there in Zoom land might recognize some of these stumbling blocks in your region as well. The participants all worked in small groups to identify issues in a variety of categories that included funding, service provision, regional and statewide coordination, staffing and fleet issues, and barriers to regional coordination. These were all common topics that came up at all of the tables. Next slide, please. And so the coalition focused our efforts on 3 facets of the problem. After analyzing the chart that we just saw, we decided to land on 3 of these focus areas. First one's coordination. Past efforts, as I've said, have been partially successful, but the momentum over time was never reached. Funding, better to align our outcomes with current guidance on federal fund grading, as well as looking outside the transit silo for support. And then finally, branding and promotion. This was our area's first attempt at a coordinated effort. And so a coordinated look and replicable outreach and education materials will be critical to not only build this out in our region, but also to be able to replicate it in other parts of Kansas, which is the big goal. Next slide, please. And now a few words about the coalition. So, as the slide says, we actually are made up of 27 members. We have representatives from the, forgive the typo, 10s, 11s, and 7s. It's also social service agencies, the Regional Area Agency on Aging, medical, hospital, and MCO representatives, city, county, MPO, and state agencies, and also the full complement of Kansas's mobility managers has been involved as well. Next slide. And each person on the committee is a professional, down to the last. Here's a shot from our first meeting. About half of the people in the shot here, I won't point anybody out, but there's a lot of strangling going on. But it was important to keep it jovial. The team all worked together. A lot of people came together with a passion for public service. They had the ability to think creatively for solutions to longstanding problems. They had a commitment to the concept that transportation access is key to living a good life, regardless of your age or level of ability. And they represented small, urban, rural, and non-transit related agencies, but they were all committed to the same goal. And so even though we look rather goofy in this photo, there are decades of years of experience sitting behind those tables, and everybody had a common purpose. So I really appreciate the cross-section that came together for the initial group. Next slide, please. All right. So here's just a screen icon of all the different agencies that were part of the coalition. Like I said, we've got Social Security, social service, aging, we've got independent living centers, multiple state departments, transit providers, both urban, small urban and rural and private, nonprofit. We have cities and counties involved. The urban corridor, as I mentioned earlier, we had all of their representatives helping us along, and a variety of other services and service agencies. So a really great group of people. Next slide. So the outcomes we realized were slightly different from start to finish, but thankfully they were different in our favor. What we wound up with could not have been possible without the hours of subcommittee meetings, Zoom meetings, outside research time, and scanning of existing documents between our monthly check-ins on Zoom to better inform our action plan. So when we started, we were hoping for a working document that outlined the important first steps that we'd have to take. What we wound up with is a robust pre-plan, including potential future stakeholders and funding sources to explore. We'd hope for a collaborative work among our agencies, setting that bar low for all those professionals in the photo. And then what we came out with was a fully functional inaugural coalition. We had a name, we had a logo, we were building legitimacy, and we had a purpose. And then the last intention was to have a to-do list of next steps to help us build that momentum that we'd never fully realized. And what we came out with was the beginnings of a future regional partnership and the development of initial marketing materials and plans for engagement. And so we're very happy to know that not only had we accomplished what we hoped for during that first meeting, but what we built throughout the process was something that is much larger and more replete than we could have even hoped for. So very thankful to all of the coalition members for that. Some of the products that we developed are on the screen here. We have the front page of marketing brochure, a little trifold, very simple and to the point. We've got the contact information for the mobility manager in that county or region or CTD, depending on how it falls. And on the next slide, we've got the inside of the brochure, which lists out every transit agency in that region, what kind of service they provide, and contact information for people for more, if they want to call in, schedule a ride, learn more. So we've got this set up as a template. So the images we're looking at right here is Douglas County. Our plan is to replicate it through other counties to the point where every CTD would have a handout that they can just say, here are the agencies working in our county. And then once the K-card program comes online, we'll have a brochure for the K-card agencies as well. So this is something that the coalition members worked on and came up with, and it just really looks great. It looks professional, which is what we were hoping for. So, yeah. Okay. Another item that we came up with is our elevator pitch. We're going to have elevator pitch cards created for all of our coalition members, and they'll be wallet sized so that they can be prepared when bringing up our work to potential funders, supporters, and public officials. We think that having the little card with an elevator pitch written on it already will take the pressure off of each individual coalition member, as well as streamline the talking points so that we're each sharing the same information about our work, the same goals, and that nobody's like scrambling or at a loss for words if somebody brings the topic up. So this would be, again, something that the coalition members had a subcommittee and worked on. And it comes down to basically, 4 sentences, who we are, what we're talking about, and what we're about to do. And then we hope that people join us along the way. Next slide, please. A key component of the actual action plan document is we did some research on both opportunities for funding, especially local funding that people might not know about, as well as using the federal grading guide for more. But we were trying to get everything from soup to nuts. So there were a couple of months of research on this one, everything from, getting your grocery store reward dollars donated to charity to, as Danielle was saying, using the Older Americans Act 3B transportation services funding as a potential source. And then we also put together a list of technical assistance. The assistance that we got from NADTC, Jeremy and Chelsea, thank you, Chelsea Beagnall, was phenomenal. It was way more than we expected it would be. They shared professional opinions. They shared real world examples that they have worked on in the past, and they were always available during the in-between times by email or a Zoom call or a phone call to help us along with the little stumbling blocks that popped up every now and then. So we really appreciated their assistance. And we also wanted to make sure going forward, KCART knew there were even more agencies that would be able to provide us with some assistance going along. Next slide. And then I talked about branding. We had some amazing people on the coalition working on branding for us. And the logo that was developed embraces the concepts of breaking through boundaries, as well as many agencies coming together in the middle for a common cause. So we're very proud of the KCART logo. It continues our themes and colors to work as part of past and current programming efforts that the mobility managers and KDOT have been doing in Kansas. So we've got this like common feel, and we're hoping that that will also lend some legitimacy to the projects that we do over time. Next slide, please. The coalition learned how to ensure that it will be a success without burning out or reinventing the wheel. But it took some setbacks to realize how to change these weaknesses into program strengths. And so here are a few of our greatest lessons learned. First of all, be mindful of anything that causes your initial plan to implode on itself. Stick to the scope you all agreed to. Scope creep happens very easily, and if you don't write it in early, things can get out of control. The concept of strategic contact development was key in getting our message out to not only the broadest audience possible, but also the people who had the most say in how that message would be shared with their staff. So as an example, I say, it's great to get your friend Mary, who's a nurse at the hospital, to buy into the program, but it's even better to get Mary's director of nursing to buy into the project. And then the Don will have access to all of the nursing staff below her. Third one, baby steps are good. Celebrating small successes along the way is crucial. Don't wait until the end to throw a party. When you guys get through small milestones, go ahead and buy lunch or whatever you decide to do. We're big eaters here in the Midwest, so we've got a banquet waiting for us behind once this is over. So I apologize for no smell-o-vision, but there's a lot of fried chicken in this room right now. And finally, be realistic about the time constraints. All of these efforts are going to take time, and we each have full-time jobs that we have to attend to still. We must consider the time it will take to execute each step of our action plan going forward, and be mindful of the constraints of working with a group of smaller agencies like we are. So with that, I will go to the last slide and thank everybody, not only for the support, encouragement, and professionalism, but also want to thank all of the coalition members that are here in the room and on Zoom. You guys did an amazing thing, and we did it in under a year. I've promised them all they can have 2 months off, and then we're going to pick things up again in July and move forward with what is listed in our action plan. So, thank you.
Yeah, thank you, Mike. And again, thank you, Danielle. This was a really great experience. As Mike mentioned, they're kind of a silly group, but that really helped our conversation. On day one, we were welcomed with open arms and ready for discussion. And, it was serious work, but we had fun while we were doing it. So that goes back to what Danielle was saying about having that established coalition makes it really great to move forward and work as a team. And so this group got a lot done in a short period of time. And I think it was because of that previous commitment as a group. We did have one question in the chat, and this one is for Danielle. We had a comment on this person was working on a spreadsheet for the New Hampshire funding expenses. When they looked at the current CCAM report from 2018, is CCAM updating the 130 programs? And mentioning specifically the column for transportation, many of the programs show data not available. Will that be updated?
So great question. The current 130 programs all remain. So we did confirm that they're all still active. So we're not going to be changing the 130. We're only adding to them. And there's been a significant number of new programs, thanks to COVID, that we're adding. We're in the process of doing that, as well as we're adding additional columns of information. So the 130 programs you see there will not change. We'll only update the spending information from the 2018 dollars to it's going to be 2022 dollars. That's what we have most readily available. And then additional information in the drop down about what's eligible under the program. The bad news is that the majority of the programs don't collect transportation specific data, because that funding question in the drop down now says transportation spending in 2018 dollars, and the majority of the programs just don't collect it, which is unfortunate. It's only an eligible expense, but not one they collect or require data on. And so unfortunately, that's not going to change significantly. There may be a few. We're still working with our partners on that. And the new programs, I have to say the majority we're finding are hit or miss on that question. So unfortunately, no on the additional transportation spending data. That's just not something the majority of the programs collect. But the 130 programs, keep using them in New Hampshire. I'm so glad to hear you guys are finding that resource helpful and using it. Those 130 programs are still good to go.
Great, thank you, Danielle.
Mhm.
Are there any other questions from the group? We have about 3 minutes left. And the longer we go, the more time Mike's group has to wait to have their lunch, so. As mentioned, we will be posting a lot of this information on our coordination page at nadtc.org/coordination. And you'll have more of that information after next week's session. That way we get both groups in there. So,
and Jeremy, I just want to mention, I shared in the chat, there's a FTA transportation coordination webpage. And there has been a little confusion about that because we posted it in March of 2020, which, something minor happened right after we published this transportation coordination guidance, COVID. And the guidance is all about incidental use and the ability to, all FTA programs allow for incidental use. And we had developed some great guidance on which examples of incidental use in programs. We also did the Budget and Policy Office did an NTD guidance about incidental use in NTD. And then COVID hit and everybody thought that guidance was specific to COVID. It's not. It's so you'll even look on that page, there's not COVID mentioned once on there. So just if that's helpful to you all, if you have incidental use partnership questions come up, and usually there's also about the exemption from charter at the bottom of that page. It's helpful. So just wanted to flag that webpage for you all.
Okay. Well, if we don't, I recopied that link Danielle was just talking about into the top of the chat there. So thank you all for attending today. Actually, our next steps will be compiling a report of what we've all done with both of our groups and talking about some of those lessons learned. So that will be coming out later this year once it's written and finally approved. So look for that, and we hope to see you next week at the same time with our group from Minnesota. So thank you all for joining, especially for Danielle and Mike and his whole crew out in Kansas. So thank you all.
Thank you.
Thank you.
Thank you, everybody.